Good day everyone. Today we Group 3 are eager to explore the complexities of the respiratory system with you. Before we embark on this journey, let's outline the learning objectives for our discussion. So by the end of our lesson, we aim to achieve the following. Provide a comprehensive understanding of the anatomy and physiology of the respiratory system. Explore the mechanism of breathing encompassing both inspiration and expiration. Examine prevalent respiratory disorders, elucidating their causes, symptoms, and available treatment options. So, with these objectives in mind, let's begin our journey together through the captivating realm of the respiratory system.
So, the lesson content of this topic: first, introduction to the respiratory system; second, anatomy of respiratory system; third, physiology of breathing; fourth, respiratory disorder; fifth, respiratory health tips; and the last is conclusion.
Introduction to the respiratory system. Respiratory system is the transfer of oxygen from the outside environment to cells within tissues, as well as the removal of carbon dioxide in the opposite way. And it is referred to as respiration. And it is a biological reaction that takes place within the cells of living organisms. Overview of the respiratory system. The respiratory system is a complex network of organs and tissues responsible for the exchange of gases between the body and the environment. It consists of the upper respiratory tract, nose, nasal, cavity, pharynx, and larynx, and the lower respiratory tract, trachea, bronchi, bronchioles, and alveoli. Its primary function is to supply oxygen to the body cells and remove carbon dioxide, or a waste product of metabolism. Importance of respiratory system in human psychology. Breathing is essential for sustaining life, as oxygen is necessary for cellular respiration, the process by which cells produce energy. The respiratory system also plays a crucial role in maintaining the body's acid-base balance by regulating carbon dioxide levels in the blood. And additionally, the respiratory system is involved in other psychological processes such as vocalization, smell, and immune defense.
Anatomy of the respiratory system. Nasal cavity. The nasal cavity is the first part of the respiratory tract. It is lined with mucous membranes and contains cilia and mucus-producing cells that trap and remove foreign particles and pathogens from the air. The nasal cavity also contains the olfactory epithelium, responsible for the sense of smell. Pharynx or the throat. The pharynx is a muscular tube that connects the nasal cavity and mouth to the larynx and esophagus. It serves as a passage for both air and food. The pharynx is divided into three regions: the nasopharynx, oropharynx, and laryngopharynx. Larynx or the voice box. The larynx is located below the pharynx and is composed with cartilage structures. It contains the vocal cords, which vibrate to produce sound during speech and singing. The larynx also serves as a protective mechanism, preventing food and liquid from entering the airway. Trachea or the windpipe. The trachea is a rigid tube composed of cartilage rings that extend from the larynx to the bronchi. It serves as the main airway, providing a passage for air to enter and leave the lungs. The trachea is lined with ciliated epithelial cells and mucus-producing glands which help trap and remove debris from the air. Bronchi. The trachea divides into two primary bronchi, one leading to each lung. The bronchi further divide into smaller branches called bronchioles, which eventually lead to the alveoli. The bronchi are lined with smooth muscles and mucus-producing cells similar to the trachea. Lungs. The lungs are paired organs located at the thoracic cavity. They are enclosed within the pleural cavity and protected by the cage. Each lung is divided into lobes. The right lung has 3 lobes and the left lung has 2 lobes, and contains the bronchial tree, which consists of progressively smaller airways leading to the alveoli. Alveoli are small thin, walled sacs located at the end of the bronchioles. They are the site of gas exchange where oxygen from the air enters the bloodstream and carbon dioxide is removed from the blood. The alveolar walls are lined with capillaries, allowing for efficient exchange of gases between the air and the blood.
Alright, let's delve into the fascinating physiology of breathing. Firstly, breathing is a dynamic process involving 2 key phases, inspiration and expiration. During inspiration, the diaphragm contracts, moving downwards, while the intercostal muscles between the ribs contract, expanding the rib cage. This action enlarges the thoracic cavity, creating negative pressures in the lungs, allowing air to rush in. On the flip side, expiration involves the relaxation of the diaphragm and intercostal muscles, leading to a decrease in thoracic cavity volume and an increase in lung pressure, forcing air out. Now, let's talk about the stars of the show, the diaphragm and intercostal muscles. The diaphragm, a dome-shaped muscle below the lungs, is crucial for altering thoracic cavity volume. When it contracts, it expands the cavity during inspiration, and when it relaxes, it decreases cavity volume during expiration. Meanwhile, the intercostal muscles positioned between the ribs assist in expanding and contracting the rib cage, aiding in breathing. Moving on to gas exchange in the alveoli. These tiny air sacs in the lungs are where the magic happens. Oxygen from the air diffuses into the bloodstream, hitching a ride in red blood cells hemoglobin to reach tissues for cellular respiration. At the same time, carbon dioxide, a metabolic waste product, diffuses from the bloodstream into the alveoli to be expelled during exhalation. Lastly, let's discuss the brain's role in regulating breathing. The respiratory control centers in the brainstem, including the medulla oblongata and the pons, keep a tight rein over breathing rate and depth. Neural control involves feedback from the sensors in blood vessels and respiratory muscles, while chemical control monitors blood oxygen, carbon dioxide, and pH levels, tweaking our breathing as needed to maintain internal balance. In summary, breathing is a beautifully orchestrated symphony of muscle contractions, gas exchanges, and neurological signals, ensuring our bodies receive the oxygen they need while efficiently expelling carbon dioxide.
Alright, let's proceed to the intricate world of respiratory disorders. First up, we have asthma. Now, asthma isn't just your run-of-the-mill breathing difficulty. It's a chronic condition where the airways get all inflamed and narrow, making it tough to breathe. Imagine you're trying to blow air through a straw that's been pinched at both ends. What will you feel? So when you blow air through a pinched straw, it will expand because the ends are sealed, trapping the air. It stays expanded until the pressure is released or the ends are unpinched. So it means that if you continue blowing, it will increase pressure that will bring potentially causing discomfort or harm through your body. So asthma attacks can be triggered by a variety of things like allergens, ang mga yabok, air pollutants, infections, exercise, and even stress. It's like your lungs have a hair trigger sensitivity to the world around them. May ara man like sa akon yung case, kay I have heart ailment, so ang akon asthma gaka-trigger if stress ako, kapoy kag makasimot sang any isog nga baho like perfumes. So treatment-wise, we've got a few tricks up our sleeves. Includes bronchodilators to relax the airway muscles, inhaled corticosteroids to reduce inflammation and avoid triggers. Next on the rooster, we've got COPD, or what we call the chronic obstructive pulmonary disease. This one's a real doozy. It's a progressive lung disease that includes chronic bronchitis and emphysema, both of which make it hard to breathe due to airflow limitation. So smoking is a big culprit here, along with inhaling environmental pollutants and sometimes unluckily genetics nga pwede na to nakuha alin sa aton mga kalululuhan. So symptoms range from chronic coughing and wheezing to feeling like you're having a struggle sa paglagap sang hangin. Treatment for COPD involves a mix of bronchodilators, corticosteroids, oxygen therapy, and pulmonary rehab to help folks breathe a bit easier. So para mas ma-avoid naton on this kind of disorder, we are always reminded that quitting or sa paglikaw sa smoking is a must. Now, let's talk pneumonia. I know every one of you are very familiar with this kind of disorder. So pneumonia is the lung infection that no one wants to invite to the party. Bacteria, viruses, and fungi are all potential troublemakers here, leading to symptoms like fever, chest pain, and the telltale hacking cough. Treatment? Well, it depends on what's causing the infection and how severe it is. Antibiotics, antivirals, oxygen therapy, and lots of rest are often in the prescription. And then there's bronchitis. It is the inflammation of the bronchial tubes. It comes in two flavors, acute and chronic. Acute bronchitis is usually a viral thing causing coughing, mucus, and mild fever. Chronic bronchitis, on the other hand, is a long-term member of the COPD club with persistent cough and mucus production. Treatment for acute bronchitis is all about symptom relief, think rest, fluid, cough meds, and maybe some pain relievers. Chronic bronchitis, though, often needs more aggressive approach, including bronchodilators, corticosteroids, and oxygen therapy. But wait, there's more. We've got a whole buffet of other respiratory disorders to cover. We have the pulmonary embolism, lung cancer, pulmonary fibrosis, cystic fibrosis, and sleep apnea. Each one comes with its own set of causes, symptoms, and treatment option, ranging from meds and oxygen therapy to surgery and lifestyle tweaks. So whether you're grappling with asthma, COPD, pneumonia, bronchitis, or something else entirely, just know that there's a whole arsenal of treatments and strategies out there to help you breathe a little easier.
Maintaining good respiratory health is essential for overall well-being. Here are some fundamental tips to support healthy lungs and respiratory function. First, avoid smoking and secondhand smoke. Smoking damages the respiratory system and increases the risk of respiratory infections, lung cancer, and COPD or chronic obstructive pulmonary disease. Secondhand smoke exposure also poses health risks to non-smokers, including respiratory infections and exacerbations of asthma symptoms. Quitting smoking and avoiding exposure to secondhand smoke are essential for maintaining respiratory health. Second respiratory health tips is engage in regular exercise. Regular physical activity improves lung functions, strengthens respiratory muscles, and enhances overall cardiovascular health. Activities such as walking, jogging, swimming, and cycling can help improve respiratory endurance and capacity. The third respiratory health tips is a practice of proper nutrition. Rather, a balanced diet rich in fruits, vegetables, whole grains, and lean proteins provide essential nutrients that supports respiratory health. Foods high in antioxidants such as vitamin C, vitamin E help protect the lungs from oxidative stress and inflammations. Adequate hydration is also important for maintaining respiratory mucosal integrity and facilitating mucus clearance. And the fourth one is maintain indoor air quality. Indoor air pollutants such as dust, pet dander, mold, and volatile organic compounds can be exacerbate respiratory symptoms and contribute to respiratory disorders. Use air purifiers, ventilation systems, and proper cleaning techniques to reduce indoor air pollutants and improve air qualities. Avoid exposure to environmental triggers such as smoke, strong odors, and allergens that may worsen respiratory symptoms. And fifth, respiratory health tips is practice good respiratory hygiene. Wash your hands frequently with soap and water to prevent the spread of respiratory infections such as the common cold and flu. Cover your mouth and nose with a tissue or your elbow with a clothing or sneezing to prevent the spread of respiratory droplets. Avoid close contact with individuals who are sick and stay home if you are experiencing respiratory symptoms to prevent transmissions to others. And number 6, respiratory health tips is seek prompt treatment for respiratory infections. If you have developed symptoms of respiratory infections, such as a fever, cold, congestions, or difficulty of breathing, seek medical attention promptly. Early diagnosis and treatment of respiratory infections can help prevent complications and promote a faster recovery.
Conclusion. Recap of key points covered. The respiratory system is a vital component of human physiology responsible for gas exchange, oxygen delivery, and carbon dioxide removal. The understanding the anatomy and physiology of the respiratory system is essential for comprehending its function and maintaining respiratory health. Common respiratory disorders such as asthma, COPD, pneumonia, and bronchitis can impact respiratory function and overall well-being. Practicing respiratory health tips such as avoiding smoking, engaging in regular exercise, maintaining proper nutrition, and practices good respiratory hygiene can help reduce the risk of respiratory disorders and promote the optimal respiratory health. Emphasis on the vital role of the respiratory system. The respiratory system plays a crucial role in sustaining life by supplying oxygen to the body cells and removing carbon dioxide, a waste product of metabolism. It is involved in various physiological processes including gas exchange, immune defense, vocalization, and olfaction. Maintaining respiratory health is essential for overall well-being and quality of life. Importance of respiratory health in overall well-being. Respiratory health is interconnected with other aspects of health such as cardiovascular health, immune function, and mental well-being. Promoting respiratory health through health lifestyle habits and preventive measures can contribute to improve overall health and longevity. In conclusion, the respiratory system is a complex and essential component of human physiology that requires care and attention to maintain optimal function. By understanding its anatomy, physiology, common disorders, and practical tips for respiratory health, individual can take proactive steps to support their respiratory well-being and enhance their quality of life. Thank you for your attention, and remember to prioritize your respiratory health for a healthier future.